Running a substance abuse treatment program is one of the most vital services a healthcare provider can offer. You are helping people reclaim their lives. But behind the scenes, the business side of that work, specifically the medical billing, is complex, time-consuming, and prone to frequent denials. Demand is at a record high. According to SAMHSA, 48.4 million Americans meet the criteria for a substance use disorder. This graph tracks national spending on treatment, which rose from roughly $41 billion in 2000 to nearly $140 billion by 2021. With patient volume and spending at these levels, many behavioral health billing departments are struggling to maintain revenue cycles under the weight of the increased demand. The mechanics of substance abuse billing require a different operational approach than standard medical visits. Billers must navigate specialized H codes, unique procedure modifiers, and strict prior authorization rules for complex, intensive outpatient treatments. This chart shows the impact of that complexity. Behavioral health claims face a denial rate 5 to 10% higher than comparable medical and surgical claims. A single denial initiates a costly administrative loop. Staff time is diverted to appeals, days in accounts receivable increase, and the resulting backlog creates a self-compounding cycle of lost revenue. In the substance abuse specialty, an unchecked denial rate creates a persistent financial strain that can threaten the long-term viability of the practice. When denials rise, many practice owners attempt to solve the problem by hiring more in-house billing staff. However, finding and retaining billers with specific SUD coding knowledge is difficult. Even experienced medical billers require significant training to master the nuances of behavioral health modifiers and individual payer policies. During this training period, the pressure of specialized coding rules often fractures the workflow, leading to submission errors that trigger further denials. This staffing strain also impacts the approval clock. Every day spent waiting for a delayed prior authorization results in either uncompensated care or a delay in the patient's treatment. For many behavioral health practices, the traditional in-house scaling model leads to high overhead and persistent administrative friction. An alternative approach is exclusively within behavioral health. These specialists are EMR native. They work directly inside your existing software, such as Epic, Athena, or eClinicalWorks, without requiring screen sharing or external workarounds. Every assigned team member is already credentialed with AAPC and AHIMA certifications, providing verified expertise in substance abuse procedure coding and documentation standards. This timeline illustrates the integration process. Because the team is pre-trained, practices can reach full, secure integration, including HIPAA and SOC 2 compliance, within 14 days. Behind these specialists, AI-driven tools automatically route claims based on complexity and run daily quality audits before any claim is submitted to the payer. Within the 2-week go-live window, this model bridges the expertise gap, replacing staff turnover with stable, clinical-grade precision. An in-house specialist for substance abuse billing typically costs between $55,000 and $75,000 a year, before accounting for benefits, training, and the cost of turnover. In contrast, the Staffingly model provides a dedicated, credentialed specialist for a flat rate of approximately $399 per week. This combination of specialized human knowledge and AI augmentation maintains error rates below 1% across high-complexity claims. Practices using this structured denial management process have reported up to a 30% improvement in overall collections. This model provides a systematic mechanism for recovering revenue that would otherwise be permanently lost to administrative errors and payer scrutiny. Behavioral health providers should be able to focus on reclaiming patient lives rather than managing the friction of a complex revenue cycle. Staffingly provides operational flexibility through a month-to-month engagement model, requiring no long-term contracts. You can deploy a credentialed team inside your EMR in 14 days to stop the denial spiral and secure the revenue your practice has earned.